Okay, my name's Pauline Pichanga, and whatever I'm going to present is all about malnutrition. I hope all of you have eaten well. I'm talking to people who are well nourished. So while we are waiting, they just let it here. I can give you a story or introduce myself. I'm Pauline Pichanga from Mombasa County, Kenya, in Mlaleo CDF. So today, I'm going to give you a project by the name Enhancing Child Nutrition and Healthy Outcomes through innovative interventions in Mlaleo Health Center in Nyali, Mombasa, Kenya. So, I'm going to give you a life history. I've been dealing with children. I'm a pediatric by profession, whereby I deal with children day in, day out, and I encounter a lot of things, whereby we get that we are really missing a lot, because if we can get more information clearly from the start, we are able to clear away from this thing we call malnutrition. Why am I saying that? Maternal child health care start from where? MCH. MCH encompasses of what? It is multi-sectoral or multifaceted approach, whereby it is what we call family planning to the mothers. We have deworming to the babies and also to the mothers. At the same time, we have health education to our mothers. Not only mothers, even our fathers. At the same time, we need to understand that we need to have 5 dimensions on how to take care of father, mother. At the end of the day, we are going to bring up a healthy kid. If we are not able to take care of our father, mother, psychologically, physically, emotionally, mentally, socially, so a disturbed mother is a disturbed child. Do you agree? A disturbed father, mother is a disturbed child. And that's where malnutrition starts from. So, we need to engage our mothers with good health education. Immunization schedule, we need to enhance them in advance, that it is good for them to have a good schedule for immunizations according to the KB schedule. This is because most of the diseases are being covered by immunizations. So if they miss in one way or another, they are going to get what we call malnutrition. So I have some sample links I'm going to give you, kind of one of you can share. You can be just checking through the links and getting to the digital platform and get to know what has been happening in our setup. So there's one case of a malnourished child, 1 year old, 2 months, with a kg of 7.2, having malnutrition at the same time having what we call tuberculosis. I get to understand that the mother had used to have recurrent missed appointments. So for me to get to know why this mother is getting to miss a lot of appointments, despite the drugs are going to help him or help the baby. And that's why if you can go to one of the links, you can get the live video which is ongoing. Because of time, I'm not going to see or to go further to that video. Let me go in line with whatever I'm supposed to present. So as the topic goes, is enhancing child nutrition and healthy outcomes through innovative interventions in Mlaleo Health Center, Nyali, Mombasa, Kenya. Presenter, Pauline Pichanga, CEO Pediatrics. Yeah, next slide, please. While we are waiting, I'm going to give you a background of malnutrition. Maybe you can help me. Let me continue giving you a background of the project while we are waiting. Malnutrition is a critical global health issue affecting millions of people, individually, particularly low and middle class countries. It encompasses what we call undernutrition, which includes stunting, wasting, and micronutrient deficiencies. And that's why, as I emphasized earlier, it has to start from MCH. MCH, that's family planning, good nutrition to the mother. They need to have good micronutrients, supplements as folate and iron. In most cases, you get mothers, they have hypermeresis gravidarum in the first 3 months. If they have not gotten the supplements, and that's where the problem also starts, we get that the neurotubes effect start from there. At the end of it all, consequences about cognitive function and development of a child is being affected. So the consequences of malnutrition are profound, impacting physical health, cognitive development, so the consequences of malnutrition are profound, impacting physical health, cognitive development, and economic productivity of the children. But we need to understand that there are some factors that come into play. And what are those factors? One of it can be poverty, food insecurity, inadequate maternal nutrition, and limited access to healthcare services. Mlaleo Health Center deployed a comprehensive, innovative strategies to address this multifaceted challenge that include social media, community engagement, education to the people, that's healthcare workers, community healthcare promoters, and even to the patients themselves. Interventions tailored to local included the social media, and this was mainly focusing on improving dietary diversity. Why dietary diversity? Because malnutrition is just all about diets. So we need to diversify. What kind of diets are we giving our children? What kind of diet our mothers, while they are pregnant, they are taking? Is it a balanced diet, or just they concentrate on one thing? At the same time, we get to promote maternal and child health by ensuring access to essential healthcare services. And by tackling it, we need to enhance healthy outcomes so that we are able to foster what we call sustainable development goals and break the cycle of poverty that affects the future generations. We need to get to know what is the problem statement. Problem statement, that's all about what is the main root cause of everything. If you are able to know what is the main root cause of everything, you are able to tackle everything. You get to know what are the contributing factors. How are you going to sustain whatever you have gotten up out of the root cause? In Mlaleo Health Center, Nyali, Mombasa, Kenya, child malnutrition still remains a critical public health challenge with significant implications for healthy outcomes and overall development. Whereby we get there are high rates of stunting, wasting, and micronutrient deficiencies. At the same time, we can get some factors like inadequate dietary diversity, poor maternal nutrition, and limited access to healthcare services play a major role. This innovative perpetuates a cycle of poverty and poor health in the community, whereby we need to implement targeted strategies that can significantly improve child nutrition and health outcomes in this vulnerable population. The main objective was to evaluate the impact of multifaceted intervention on child nutrition and health outcomes in Kisauni, Nyali, Mombasa County. So there were various methods we used so that we evaluate that. We did what we call exploratory study design on the potential of innovative digital health technologies. That is including TikTok, YouTube, Instagram, and Facebook, who are assessed for the ability to enhance the delivery, uptake, and monitoring of nutrition interventions among children in Saoni. So for those ones who have gotten the linkages that I have given out, you can just check through the YouTube, Dr. Pauline Pichanga. From there, you can get whatever we are discussing all along. So there were also what we call systems thinking approach was employed, and outcomes measured included severe acute malnutrition and moderate acute malnutrition among children. That's what we call SAM and IMAM children. Also, we were able to correct the data, baseline data and endline data. Then from there, we were able to see how things are working. I'm going to show you in the next slides. Qualitative data from focus groups and interviews was analyzed thematically, while quantitative data was prepared in tables and presented in graphs. So what were the interventions that we did? One, nutrition interventions. That is nutrition education. It has to start from MCH, as I said earlier. You need to take care of our mothers while they are pregnant, while others are just checking about family planning. What kind of family planning are they going to take? And especially this one goes about first mothers' babies, or first mothers who are not able to breastfeed their baby well. Why? Once a mother starts breastfeeding, maybe for example, it is breast, and you get that the mother is having plenty of milk, and this one is also dripping of milk. So instead of the mother concentrating on this one breast to feed the baby because it's enough and it has all the components essential for the baby, so the mother can just swipe the baby to the other side, whereby the baby is going to drink what? Only water. You understand that? At the end of the day, you see, the breast has compartments. Water, the first compartment is about water, just to quench the thirst of the baby. The second one is all about carbohydrates, coming to the ribit and the fats. So if you get the mother breastfeeding only the dripping of milk, at the end of the day, the baby is breastfeeding what? Breastfeeding what? And what are you expecting at the end of the day? Malnutrition in such a way. The baby is not gaining weight. There is what we call failure to grow. And other setup can come in like diseases because there will be lower immunity for our babies. And that's why we say supplementation program, it has to start as early as possible. Not necessarily from the government setup. It can be from local or low vegetables and foods. that are readily available. So another interventions was about community facility-based support network. So this one is all about community dialogue, where we were to engage community healthcare workers and promoters to go hand in hand, even to the village, to let the people know what is the importance of nutrition. And to some extent, some of them have a lot of stigma. When the baby maybe has malfunctions and has malnutrition, it's difficult for them to access the care or the services in the hospital. And some of them, surprisingly enough, they live in a congested houses, whereby you get that one of them can be having what we call tuberculosis, and at the end of the day, the baby can also get tuberculosis. At the end of the day, complications sets in, we lose our baby, just like that. We have also outreaches. We used to have outreaches, both inreaches and outreaches, so that we are able to gather all the people and they need to get all the information required. There is also what we call WASH activities. What are they? This is all about hygiene. Hand hygiene, whereby in every setup in our own facility, we have put various ways. Before the patient goes to the doctor, he or she has to do hand washing. After toilet hand washing, there is also provision of sanitizers. And also drainage system also have been created in a better way. At the same time, we have a team once in every month whereby it comes and do thorough cleaning of the whole hospital. Not only that one, we do have what we call Kaizen, where we do weekly, we do check the 5S if it has been done. That is sorting, setting, shines, standardizing, and sustaining. Then, another intervention is all about referral and linkages. What are these? Integrated vertical and horizontal referral system. And that is true about community healthy promoters. That's where they help us a lot. They go to the villages and they spread good news about the hospital. If at all we have some campaign in the hospital, we use the healthcare promoters to assist us in that area. Other innovations was about digital innovations, that's video uploads, which is being done once weekly or twice weekly. That is through YouTube, Facebook, Instagram, and TikTok. What were the results? 2023, you can see how it was performing. So the PLO stands for severe acute malnutrition. The yellow stands for moderately acute malnutrition. And for the green is for the discharged patients. And for those ones who have improved well. So you can see, November we had 5 severe acute malnutrition. There were no end discharges. In December we had still 5. So among the 5, 1 improved from severe acute malnutrition and came to moderately acute malnutrition. Then coming to January, we can see we had 4 of them with severe acute malnutrition. In January, at least, after health education, we can see an improvement. Other than getting more of the severe acute malnutrition, now we are getting moderately acute malnutrition. And then we had only 1 discharge. Then coming to the end of the taking of the data, that is on February, we had 10 with severe acute malnutrition. We had 13 with moderate acute malnutrition and 3 discharges. Are we doing good? Are we doing good? We are doing good, I can say, because at least the number of severe acute malnutrition is not increasing. But instead, we are moving back to the normal nutrition status which is expected for our children. Are you understanding now? So in March, we get severe acute malnutrition 15, then moderately 13, and discharges were 5. In April, we had 11, we had 8 mom and 2 discharges. I think from April, that's where we started our nationwide strike, which in one way or another, it affected one of the healthcare services. So qualitative findings, interviews and focused group discussions revealed increased satisfaction with health services and a sense of empowerment among parents on nutrition. Increased hand washing and sanitation practices. Positive dietary changes. Positive dietary changes, more especially after the baby is being weaned. In most cases, you get the baby is weaned, whereby in our local language, you can say they make porridge with almond seeds, that with a combination of seeds, like 8 of them. Yani mbegu saba, yani kuna millet, sorghum, kuna maize. They make a mixture, but at the end of the day, you get, it's not helping at all because all of them have different boiling points and all of them play a different role in our body. For example, for the wimbi, whereby it's just provision of iron, calcium, that is cassava, it hinders absorption of iron to the body. So at the end of the day, you get the baby is getting low HP, and subsequent of it, the baby gets to severe anemia. With severe anemia leads to severe complication, malnutrition sets in. So that's why we can say that health education is really paramount. Conclusion. The multifaceted intervention, which combined nutrition, health education, micronutrient supplementation, wash improvements, and digital innovations, was effective in enhancing child nutrition and healthy outcomes in Saudi, Nyali, Mombasa County. Recommendation. This study provides evidence for the implementation of integrated community-based approaches to address the complex and interrelated challenges of childhood malnutrition and poor health in SIMRA resource-limited settings. So, healthcare workers on mentorship on child malnutrition. As you can see there, I was able to give healthcare workers mentorship on child nutrition. Not all of them, as much as we are medics, understand the inside of the child, what is supposed to be given. Why am I saying that? You get healthcare workers, or not only healthcare workers, we're all working class people. They leave their children with who? Care workers or house girls in their house. House girls with no knowledge on how to take care of the baby. House girl with no knowledge on how to substitute or to do formulation of other supplements like NAN. You see NAN, once you have supplemented, it has its own timing when you are supposed to give the baby, and how are you going to reconstitute with water? Leave alone. Sometimes the baby can cry a lot. Maybe there is no enough food or milk in the house. House girl can, or another care worker can opt to go and check for cow's milk. You know cow's milk? Cow's milk is not good for the baby, especially less than 1 year. Why am I saying that? This is because the kidneys of the babies and their livers still are very immature. So it brings what we call indigestion problems, bloating, At the same time, it ends up to diarrhea and vomiting for our children. Subsequent of it, you can get more other diseases setting in. There's also a feed on the same, you can check in the linkages I have given you. So nutrition training session to mothers. So these are community care promoters with their uniform. Here I am with also the mothers, training them on how to take care of our babies, to have good nutrition, on how to help our mothers have good family planning with spacing. The importance of immunizations for our children. Because in one way or another, you get a mother misses to come to the clinic because maybe of financial issues. But with such cases, we encourage the healthcare promoters to tell them, just even if the baby has missed the immunizations, they have to come and we have to give them so that we can prevent our baby from getting more infections in the future. So sample links, these are the ones that I have given you. Links to my digital platform for creating healthcare awareness. That's Dr. Pauline Pichanga. We have our current video ongoing. Video for home visitation of a child missed appointments of treatment despite having tuberculosis and malnutrition. That is the link. There's also health and lifestyle awareness and management of malnutrition. There's also about breastfeeding. You can get the link. There's also what are the long-term consequences of malnutrition in children, both physical and cognitive functions. In this area, I have explained if the baby is not taken care of, cognitive functions and development doesn't develop well. And that's why you get even if your baby was to be the sharpest in the class, you get in one way or another has been affected. Or maybe in the future, it was supposed to be very fertile, but in one way or another, malnutrition has affected the baby. What are the connections between malnutrition and poverty despite adequate food production? This goes hand in hand with unequal supply of healthcare services or food insecurity. That one plays a very big role there. We have also breast milk versus non-milk versus cow milk comparison. I have done a practical experience about it, and I have just done it, how the kidney are working with all this, and we are able to know or choose which is the best milk for my kid. Thank you. So I acknowledge the Mombasa County Department of Health, County Health Management Team, Nyeri Sub-County Health Management Team, Njomfu Sub-County MOH Phyllis Kemunto, Mlaleo CDF Health Center staff, community health promoters attached to Mlaleo CDF Health Center, Kisauni Nyali community members, local provincial administration. Thank you.
A serious round of applause for the presenter. Thank you. You know, it's very difficult to present after lunch. Most of the people are digesting, and it's not that easy. Actually, before I hand over the mic to Paddy, the Secretary General, I wish to call upon Margaret. Sorry, not Margaret, but Mr. Njeru. We have new guests in the room, Professor and Amos, so that you can introduce the guests. You know, their titles is so weighty that I don't feel fit enough to introduce them to this congregation. Karibu Daktari.
Thank you very much, presenter. I don't know whether there were any questions. Maybe none. Let us appreciate Phyllis as she resumed. Yeah? Pauline, sorry. Thank you very much. I think you have exhausted and preempted. There is one. Let him ask. Oh, he's taking a video. Okay. I think amongst us we have new arrivals. And it's my pleasure to introduce just arrived guests from Kenya. We have Professor Simon Kang'ethe. Professor Kang'ethe is the chairman of Kenya Clinical Officers Council in Kenya, the regulatory body. And with him is the registrar of Clinical Officers Council of Kenya, Mr. Abraham Wako. So feel welcome. You are not too late. You'll catch up as we continue. Thank you very much.
Thank you. I think before we conclude, kindly, we had a hand up. I'm sorry. We had a hand up. Just one question, a minute. Then we finalize. Thank you. Welcome.
Thank you so much, Pauline, for your wonderful presentation and the consideration about to tackle malnutrition in Kenya. Bringing interventions is quite a tough job. I've never been to Kenya before. You are the one who could probably respond. I was looking at the community that probably I don't have a picture of the community for your target population. For sure, we know that you also provided one of the link, which is telling us about malnutrition and poverty. Especially when we are talking more about malnutrition, especially it focuses more towards, it clings towards people that are underprivileged. So, one of the intervention which was there was more on Facebook, YouTube, TikTok. I don't know the usage of the people, because I assume to say the people that are more into TikTok, Facebook, probably they are like this brother of mine. Despite not giving the usual meals at home, the kids cannot be malnourished. But the interventions that are there is giving probably, you mentioned of food supplements. So are they needed, or what's the community for the hospital that you were targeting? Thank you.
You've gotten the question?
Yeah.
Thank you. You can respond to that before we finalize.
Okay, the target here is under 5 children. And under 5 children, we get to understand it's all about, we start from the MCH, that's maternal child health care, whereby we need to give more information on health services to the mother to get to understand about nutrition-wise, what kind of food to take, so that while the baby in conception does not get affected in one way or another by just not taking enough supplements like folic acid or iron supplements, which are very good for neurotube effects. If you get neurotube effect for the baby in one way or another, you get that the baby can be born, and from there, is not able to maybe to breastfeed well, or has some dysfunction one way or another, a cleft palate, cleft lip. So in such a way, the baby cannot breastfeed well. At the same time, I approached the mother in such a, when the mother has more information about what kind of food to take. That is a balanced diet. Proteins, carbohydrates, and vitamins, plus the balanced diet, as I said, plus at the end of the day, hygiene-wise, the hygiene should be paramount and of high standard so that we are not able to introduce infections which in one way or another can affect our kids. And about healthcare promoters, you see, our patients, in most cases, we have linkages to the community. Community, that's where the people in the surrounding community have also a lot of trust with healthcare promoters, whereby in one way or another they can reach to them and explain to them, this and this is happening, what can I do? And as a healthcare promoter, they can just refer them to the hospital for further management.
Thank you. Thank you. I think it is very well elaborated, and I think you are so informative in your presentation, and more of it, you've provided even the linkages we can get the information from. Thank you very much. It has been a very sweet presentation in this monumental assembly of these delegates. We want to thank you, and the best way we can thank you is, first of all to be upstanding. That's how I like appreciating presenters, especially being ladies. All be upstanding. If you respect this beautiful, first of all, if you respect Botswana, be upstanding. We want to see who doesn't respect Botswana. Yes. Is there anybody who doesn't respect Botswana? Now we have to give a Botswanan clap. How do they do it? Okay, give a shout of Pula, everybody. Another one. Thank you very much, presenter. We appreciate so much. Let us get directions from the Secretary General. You're welcome, sir.
Thank you very much, Xavier. Pauline, I think you're done.
You can go sit.
Yes, you can go sit.
Okay, thank you so much.
Yes, you're welcome. Yes. Ladies and gentlemen, let's put our hands together for Pauline again. She has done so well. Her presentation was very informative and insightful. Yes. We had two late arrivals who are very important dignitaries to this conference. I think tomorrow morning would give them a befitting welcome and a befitting introduction. So, Prof. Simon Kangete and Mr. Ibrahim Wako, my apologies. Tomorrow we are going to welcome you when conference resumes properly. Yes. That will be all for today, because all of you are tired. I can see. Yes. Normally, after lunch, the thing goes down like this. So, I understand. Yes. So, we'll take our recess now, and then we'll reconvene tomorrow morning at 8 a.m. 8 a.m. Not 9 a.m. Please. 8 a.m. There are some things we have to finish today that we are pushing to tomorrow. If we don't come early, we are going to tarry tomorrow. So please, let's try and be here at 8 a.m. Thank you very much. So, conference has gone into recess today. We reconvene at 8 a.m. tomorrow morning. All the best and have a good night. Thank you. Thank you. Pula! Yes. All right. We'll see you tomorrow. Working with people is very tiring. Is there? The football match, yes. Yes, the football match is 2:30.